Hello, my name is Tyler Sawall, and I'm here with Dillon Abhold.
Hello.
And we'd just like to take a few minutes to talk a little bit about improving medication adherence in the geriatric patients. This has been a pretty hot topic in recent news, and there's a lot of different ways that people are trying to tackle this problem. And one thing that we've been very interested in is the use of medication applications to help aid in this process. And there's a lot of different ways that this is approached, but we'll get into that a little later. So the geriatric population currently stands at about 47 million, and those people are qualified are over the age of 65. And with the recent aging of the population, there's expected to be a dramatic increase in the next 20 years or so to 75 million patients. And typically, as it stands, between the ages of 65 and 69, the population takes approximately 14 prescriptions, and that only increases as they continue throughout age. And following medication regimes like that, there's a lot of different ways that people can go wrong. You can mix up a lot of medications, and anything that we can do to help straighten that out is definitely something that we'd like to look into. Another big concern about geriatric patients is the fact that their health literacy isn't necessarily where it needs to be based on all the things that they're approached. We just discussed that there's a lot of different medications that they're on, a lot of different health problems that can occur, and there's roughly 33% have poor health literacy overall. And this is something that's a big concern because keeping track, let's say you were even on 8 medications or 7 medications, half of the average. That's a lot of different information that you need to keep track of. That's a lot of different dates and times and things that you need to make sure that you're overall staying on top of. And moving on, there's 80% of people have marginal health literacy. So they are coherent, they understand things, it's just maybe not to the point where they definitely for sure are comfortable with everything that they're working on. And so there's different things that we're looking into, and the medication application is something that could potentially address different concerns that geriatric patients might have while taking the regimes. And things that we're going to go look into is drug monitoring, different things such as insulin. After you use medication, keep track of how it affects your body, different ways that you can keep track of your personal health as you're taking this medication. Medication scheduling is a big one. There's a lot of different areas that things can go wrong. There's a lot of different timing of medications, taken 1 to 3 times a day at different times. There's a lot of different mix-ups that you can have. And then there's a couple medication applications that provide different incentives. It's kind of an interesting way to go about it. It's kind of a reward system based on how well you do keep track of everything that you're trying to do for your personal health. And so we're going to get into a couple examples for you on how this is taking place.
All right, so first we're going to talk about medication schedules apps. So first, the big app is MedHelper Pro Pill Reminder. It is for Apple and Android. And there is another app called Pillboxy, which is Apple app only. And how we decided to choose these 2 apps were we found a journal that pretty much has talked about the overall the top ranked in quality and that people use the most and why they use them the most. And the reason why people use the MedHelper Pro Pill Reminder is for the high privacy and usability. And the reason why people use Pillboxy is because it's highly reliable and relatable to what they're using it for and everything like that. Another area that this journal covered was drug monitoring. Cancer.net Mobile TM is for high privacy, usability, and reliability that the patients found best suited for. And also the Blood Pressure Diary Pro was another application that people used, and they use this application exactly for the same reason. It says it right in the name, for blood pressure, and like Tyler mentioned, to help track their success rate and seeing if their blood pressure would go down or up. Just kind of like insulin, you can check to make sure your blood glucose levels are good, and so everything along them lines. And the ideal app that hopefully Dr. Albano is going to produce with his application is something that's easy to use for an interface, has a section for patient education, and there's some way that the actual patient or the person that's using the app can contact the prescriber or pharmacist if they have a question. And questions could be like the drug-drug interactions, or the application itself could have a drug-drug interaction tool in there to see if, like, you type in the two different drugs, it'll tell you if there is an interaction or if they should not be taken together. Missed doses, so let's say if you forgot to schedule in an alarm at 8 o'clock in the morning to take a medication that you're on, well, all of a sudden, let's say you missed that dose, you could look it up on the app and it could tell you exactly what to do if you missed the dose or if it's close to the next time or anything like that, and suggested times when to actually take that medication, if you're supposed to take it in the morning, at night, after food, before food, with food, anything like that. So ideally that's something that Dr. Albano is working on, is something to integrate all of these different areas into one special app. And these are the references that Tyler and I used to make this PowerPoint presentation for you guys, and hopefully you learned a lot about the medication adherence apps for geriatric patients. All right, you guys have a good rest of your day.